Thank you for joining us for another session, another series of Wellness Wednesdays. Today's session will touch on mental illness within the Black community, African American community, how you see fit. Tonight's guest speaker, we have Mrs. Page from the Apalachee Center. I know she told me not to call her by her last name, but I'm being respectful this evening. She is the registered mental health counselor intern at the Apalachee Center, and you guys are located off of Capitol Circle, correct?
Yes, the main office.
Okay, so the main office is on Capitol Circle. I get the northwest, southwest, all that
Yeah.
confused. But it's
Yes.
near Skate World, you all. So if you have been on that side of town near Skate World, that's where Apalachee Center is. It's right across on the other side of where Skate World is located. But yes, Mrs. Page has a lot of valuable information that she wants to share with you all. And without any further ado, I'm not going to go into a whole bio. I'm just going to turn the Zoom screen over to Mrs. Page. And she may be having a slight technical difficulty because she has frozen. So bear with us this evening. Mrs. Page's floor is all yours.
All right. Thank you, Charlie. Good evening, everyone. And thank you for having me here. And thank you guys for taking the time out just to be here and be a part of this event that is so well needed, especially now, having that conversation about mental illness, mental health, and in reference to it being Black History Month and having, set inside the time to just kind of focus on mental health issues surrounding the African American community. So again, thank you for having me here. Again, my name is Robia Miko Page. I am a registered mental health counselor intern with the Apalachee Behavioral Center. And I have been working in the mental health field, just a little background about me. I've worked for about almost 15 years in the mental health field. I've worked with individuals in the community setting, such as outpatient setting. I've worked in inpatient setting, acute setting, psychiatric hospital with Apalachee Center. I've worked in the prison setting. I've done case management on an outpatient basis. I've worked with homeless population. I've worked with homeless veterans, transitional housing. So I've kind of been around the block with working in the field. And currently, my current position, I am an intake counselor at the Apalachee Behavioral Center. I actually just started that position about a month ago. And my main role there is to do intake assessment for individuals who are seeking services on an outpatient basis. So we may have clients who are being discharged from the hospital, our hospital, or TMH or Capital Regional. I believe Capital Regional has a behavioral setting, or someone who's just, relocated and they're looking for mental health services. So just a little background information about me. So tonight's topic, mental illness in the African American community. When I received the email, or actually when I was asked to do this presentation, I was like, wow, there's so many other fully licensed clinicians who are qualified, me. So I was really taken back, but I'm glad that I was asked because I'm here and I really want to do this and be a part of anything that will improve the community, especially African American community. So here we are. And thinking about the topic itself, mental illness, and how it affects the Black community, African American community. Wow, we could talk about this all night. months, days, just talking about mental illness itself. So tonight, I'm just going to touch on some general overview facts. I have some references, of course, and statistics. So just a condensed version of mental illness and just how it affects the African American community. So you guys who are listening, who are viewing, this is information that's out there, empirical research-based evidence, the references, National Alliance for Mental Illness, otherwise known as NAMI. Also, I think APA, American Psychological Association, just some of the references that I've used. So these are information that you can Google and for your own reading to just kind of, just kind of explore what's going on and how it affects the community. All right, so let's just jump in, okay? Let's talk about mental illness and its definition. When you think of mental illness, what comes to mind? What comes to mind? So I have a definition, and this is the National Alliance for Mental Illness, NAMI's definition. Of course, there are other definitions, but it's the same thing, just worded differently. So mental illness, what does it mean? A mental illness is a condition that affects a person's thinking, feelings, behavior, or mood. These conditions are deeply impact day-to-day living and may also affect the ability to relate to others. If you look at the statistics, 1 out of 5 adults in the United States will experience mental illness. So if you think of everyone that you come in contact on a daily basis, just think 5 people that you come in contact with. One of those individuals will experience mental illness. That's a big number. 1 out of 5 people every day that you come in contact will experience mental illness. Also, 1 out of 20 adults will experience a severe mental illness each year. So already we know 1 out of 5 people that you come in contact daily will experience mental illness. And now the stats even grow higher. 1 out of 20 adults each year will suffer from a severe mental illness. 1 out of 6 minor children will experience a mental health disorder each year as well. So this is not just adults. This is also including children. As early onset, ages 6 through 17, when we refer to children or minor, okay? 50% will be diagnosed with a mental illness by age 24. Now, you guys that are in college, 24, you think about it, 50% of the population, the US population, that's like half the population. When you think of 50% will be diagnosed with a mental illness by the age of 24. So you think, what's going on, right? Okay, so I wanted to identify some shared positive cultural values within the African American community, because again, this night is specifically targeting mental illness, addressing mental illness in the African American community. So I just wanted to give some general statistics about mental illness. So now we'll kind of discuss more about how it affects the African American community. So, let's identify shared positive cultural values within the African American community. When you think of shared cultural practices and norms, you think of food, music, festivities, specific roles, values, and beliefs. Those are things that we share as a culture, the type of music we listen to, the type of food we eat, religious beliefs, specific roles those are things that we share as a culture, right? Religion, spirituality. So those are shared positive cultural norms within the African American community. Now, when you think about that, you have that positive shared cultural norms. And in a little bit, we'll talk about those negative cultural norms, what's impacting our community on a negative level that contributes to mental illness. But before we get to that, we define what mental illness is. So, let's talk about what causes mental illness, because there has to be a cause or a reason. What would make someone impaired to the point where they can't function on a daily basis? They're unable to cope in their settings, home, school, work, right? So what causes mental illness? Well, research shows it's a combination of environmental and genetics. So when you think about the cause of mental illness, it can be hereditary, passed down by genes. You can, just like physical health issues, you can be predisposed to mental illness. If someone in your family is diagnosed with, say, major depressive disorder, on either side, paternal, maternal, that can be predisposed to the child. Okay, so that's something that research has shown, that individuals can be predisposed to mental illness. So we know it can be caused by genetic makeup. Also, environmental factors. When you think about environmental factors, what comes to mind? Well, we know that there are babies who are born that are predisposed to mental illness due to environmental factors, right? Exposure at birth. So, for example, if the mother or father was abusing drugs or alcohol at the time, then that child can be born with some type of birth defect, right? So that can also cause mental illness when a child is predisposed by birth. So, and substance abuse is also in the category of mental health disorder. More of like a subheading, and that's a whole nother topic. When you think about substance use, substance abuse. So environmental factors, substance use, and also dangerous chemicals. If you were born in an area where there's toxins, toxic chemicals, again, you're exposed, the mother exposed while she's pregnant, then that child can be born with some type of birth defect. So there are, many other environmental factors as it relates to being born to being predisposed to having birth defect that can later on cause developmental or mental illness. Then you think about environmental stressors. When you think about environmental stressors, again, what comes to mind? Keyword stressors. Well, throughout history, we've seen there's been a lot of traumatic event or experience. You think about school shootings, you think about 9/11, you most recently the Capitol, those are some traumatic events that have occurred throughout history in our time. And certainly if someone experienced some type of traumatic event, as a result, that person can develop a mental health disorder, whether it's acute stress disorder or post-traumatic stress disorder. Those are some things that can be contributed by environmental stressors. Also abuse. If you're someone who was physically or sexually abused, those are some factors that can contribute to also having mental illness. And there's also brain chemistry. When you think about brain chemistry, oftentimes you'll hear people say, there's a chemical imbalance of some sort why someone may have a mental health disorder. So there's also that brain chemistry. So just to go over those causes, when it relates to mental illness. Now, mental illness in the African American community, and I wrote, just as a side note, mental illness itself is non-discriminatory. So the mental illness itself doesn't know that you're Black or white or Asian or Latina. It does not know your race. So mental illness itself is non-discriminatory. However, how we choose to deal with and treat the illness, that's usually when discrimination may play its part. Okay, moving right along. So now let's talk about some negative contributions when addressing mental health issues within the African American community. Well, we see through time, we've talked about how environmental stressors can contribute to mental illness. Well, yeah, and as a negative contribution when addressing the mental illness, that's also a factor, environmental factor. Where the individual lives, their surrounding, their home, their neighborhood, all play a part in how we address mental illness. If you're someone that lives in a low-income community, oftentimes the resources are not available, or if they are available, the individual may not know, they may not be aware, they may not have the means just to receive those resources. So, and I will say over the years, we have gotten better as a society in providing resources and trying to reach out to people in rural areas, in smaller communities, and in poverty-stricken communities, and in order to provide those services. But again, there's so many misconceptions and just lacking resources and misinformed information where people are still not getting the resources that they need. So we've talked about the environmental factors. What about the cultural experience? That can also become a contributing factor towards mental illness in the African American community. And when I say cultural experience, we talked about the positive things as it relates to people in the community, African American community. Earlier, I spoke about the church and beliefs and as a support system. Over the years, in my experience and working with individuals in the community who have mental disorder, mental illness, I would say a good percent of the clients that I've worked with, when it comes to the church, which we've always seen as a pillar in the African American community, it's also there's still the stigma when it comes to mental illness. And if you're someone who is religious or someone who goes to church, oftentimes I will hear clients say, they've been to churches where they were encouraged to, pray away the mental illness, or, just they were discouraged to really seek out help by someone who's qualified, because the focus was, the religious aspect of it. And by all means, I am for what's going to help you. I'm for what is research-based and on a holistic level, a spiritual level, a combination of whole health. That's what's going to help you. But if you're discouraged by your religious leader, like your pastor or someone in the church who believes that you shouldn't take the medication, or you shouldn't go and seek mental health services from a qualified professional, then that poses as an issue, because people are looking up to these individuals for, as leaders, for guidance. And the church is a pillar, and counselors, you go to church to get counsel spiritually. And so that has become, it's both positive with the support as far as being a pillar in the community, but I've also seen where people have been discouraged to really focus on addressing the mental health, because the focus was, prayed away, and that was the all and all. So that sometimes can pose as an issue. Fear of seeking mental health services outside of our race due to mistrust. That is a big, big part of it. When you think about someone who of African American descent, oftentimes we will not seek counseling. We would not seek mental health treatment services because of fear, because of, again, the stigma, the experience that we've had, and I say we because I am of African American descent, but just the fear of mistrust that we've seen throughout history. We've seen it throughout history over and over. And so that has been a big part of why we are still hesitant to seek outside of our race. And you should be able to seek outside of your race, seek someone who is competent, culturally competent, qualified, and experienced to help you. Whether that person is African American, Caucasian, but having the competency, cultural competency to help you as an individual. So fear is one of the big reasons why we see that negative contribution to when addressing mental health. Also, racism. There are many forms of racism. And again, we see throughout history, and we've seen it, and sadly, we're still seeing it even in today's society. And so when you think of racism, how does that play a role in someone in the African American community not addressing mental health or not receiving proper mental health services? You think about systematic racism, the legal system, the educational system. Those are some things that create barriers to people in the Black community with receiving services. And I've worked with individuals who were incarcerated, that, they were released and they may be on probation, they're still going through the court system, and they are also receiving mental health service. And sometimes it can be a double-edged sword for the individual. The educational system also, again, when you think of where you live, your environment. If you live on the north side of town versus the south side of town, it will tell you the type of educational system that you'll be that your child will receive. So we see those types of racism that can affect how we receive services in our community. Also, structural racism. Again, where you live, where you work, where you attend school, where you shop, access to proper health care. Those are all contributing factors to how we address mental illness in the community. Okay, so now that we've gone over how and why and the cause, we've defined mental illness, then let's talk about seeking treatment, right? Of course, it's up to the individual to seek services. Services not for someone who is experiencing mental illness, whether they're diagnosed or undiagnosed, that person have to be willing to receive treatment for it to be effective. Now, unless that individual is court ordered or court mandated. But again, as we focus on the African American community, when it comes to seeking treatment, African American adults are more likely than Caucasian American adults to report distress. More likely to, experience emotional feelings such as feeling sadness and hopelessness. Experiencing mostly everything in life as a struggle. When you think about the African American culture and you think about where we've come, and you think about the barriers, again, experience mostly everything in life as a struggle. Furthermore, those living below poverty level, which we talked about earlier, report more severe psychological issues than those who were more financially stable. So again, you think about where you live, the location, and your status. Are you lower class, middle class? That also play a big role in how you address mental illness in our community and availability to resources and treatment. Feeling ashamed. And again, fear of being ridiculed by family members, friends, and in services were sought after. I don't know how many of you guys may know someone that may have shared with you, at one time or another, they may have felt depressed, may have thoughts of suicide or other symptoms, related to mental illness. But they haven't told their families. If they've told you, then that's good, but they haven't told family members, and they might have not even go any further in seeking services because they feel ashamed and they feel ridiculed. And I've had, again, my experience working with individuals, or even in my own family, relatives, I think most of us can relate to having an uncle or a cousin or some distant or close family member that you're always in the back of your head, like, something's not right with this person. But no one ever addresses it. No one ever talked about it. No one ever say why uncle, stays in his room or cousin is like this. It's never addressed. And so there's that stigma. There's that feeling ashamed, feeling ridiculed. You can identify the symptoms, even if you don't know the proper terminology, that something is off with this individual. There's something going on, even if you don't know what it's called or how to again, the proper name, but you have experienced that with someone or, friend or relatives. And so being able to talk to someone, especially family, having that support is a big key. It's very important for you to feel comfortable to know that you can go and talk to a loved one and just express how you're feeling. And so that's something that, again, I've seen within the African American community. Clients that I've worked with in the past, and they shared, they felt more comfortable talking to a stranger like myself or other counselors because we're neutral. They could not talk to their family member and just express how they're feeling because they would be ridiculed. They will, be seen as they're weak, or there's nothing wrong with you, And so again, we see that in the community. So it's just sad. It's really sad. So when we think about receiving treatment services, looking at the stats, sadly, only 1 in 3 African American adults who need mental health services will receive such services. African American adults are less likely to receive guidelines for consistent care. So if someone is experiencing a mental health crisis, sometimes, they may not know who to call, where to go, how to receive help. They again, the resources may be there, they just lack information and how to receive the resources to get help. African American adults are less likely to receive guidelines for consistent care, more likely to use emergency room and visit their primary care physician. So again, if they're feeling down, depressed, having a crisis, they may call their doctor. They may go to the emergency room because again, they may not have that resource to contact a mental health crisis hotline or to seek out a mental health provider in their community. When you think of socioeconomic status, in 2018 alone, approximately 11% of African Americans did not have health insurance. That's still, 11%, that's still, when you think about the entire US population, it's not an extreme high amount, but it's still in the numbers. It's still in the numbers. So, when you think about it, for just that year alone, there's 11% African Americans who did not have health insurance. And I will tell you, if you have health insurance, because that is a big business when it comes to claims, and that's the whole nother topic, insurance and paying for services. Most places, if you don't have insurance, you won't get the quality service. And that's not just for mental health service, that's for, physical health service as well. If you do not have health insurance, then you are most likely, you won't receive the quality care that you should, that you need. So it's important to have health insurance. If you don't, then again, there are services available, certainly in the community. It's just, again, knowing how to receive those services, where to go, who to contact, and, you may sometimes pay out of pocket. But again, over the years, I've seen an increase in just services being available and, just in the community as a whole. And I will say, not just because I work for Apalachee Behavioral Health Center, but, they're one of the providers in the community that offer services to people who are insured or uninsured. So whether you have insurance or not, you will receive the services. Okay. 63% saw those seeking mental health treatment services as adequate or weak than those who did not. So if someone contacted, a mental health facility or a behavioral health provider, again, there's still that stigma in the African American community that you're weak. If you're reaching out for services, you're weak because there's nothing wrong with you, or you just need to get over it. And so that is also a big issue in the community that prevents people from seeking services, because again, there's this backlash from loved ones, people close to you, who are going to look at you and view you as inadequate. Only 25% of African American population seek mental health services, compared to 40% of white Americans who seek mental health services. That's a big gap. 25 to 40%. That's a really big gap when you do the math. Okay. Let's talk about some biases as it relates to receiving mental health services in our community. Inequality to healthcare, which we talked about earlier, for those underprivileged in predominantly Black communities. And we see that from time to time. You know, some other biases, you know, providers may be of non-African American background and unfamiliar with African American culture, cultural norms, which may cause, you know, misdiagnose, or someone to be overdiagnosed with a mental health disorder. And we see that especially among African American males. Again, I encourage everyone and anyone who is experiencing a mental health crisis to seek help, and not so much to think about, you know, who the race of the provider. However, again, research has shown that, you know, biases do occur. And if you're not familiar with the cultural norms, you can misdiagnose someone or overdiagnose that individual. And we've seen that. Research has shown that. Also, lack advocacy. If you have no one to advocate for you, then you're pretty much by yourself. So that's really important, to have a support system. It's really important to have some type of advocacy, someone who can really advocate for you. Again, working with clients whom they may need help with, you know, applying for, you know, services or other services like Social Security, or in the school setting, we work with children in the school setting, and sometimes the individual may not know how to express themselves, and they feel comfortable with you, you know, as an advocate for them, and you're advocating on their behalf. You know, the type of, if they're on medication, if they're seeking services and have been receiving services, sometimes they may not understand the diagnoses. They may not understand the type of medication that has been prescribed. So we've seen some bias in that area as well, and lacking advocacy, proper treatment services, you know, to individuals in the community. So we talked about all of those topics and contributors to mental illness. And, you know, so what do we do? You know, treatment services, receiving treatment, available treatment. You know, how do we break the cycle? How do we break the cycle of mental health barriers in our community? I think that is one of the bigger issue that I see in the African American community that still exists today. And so in order to move forward to help someone in need that has a mental illness in our community, we just, you know, we have to work on breaking down those barriers. So I kind of took not a quote, but reading an article in the Mental Health America, and the psychiatrist that was in this article talked about, let us dig up the root. And I thought that was a very interesting article. It talks about mental illness and how it can be traced back to slavery. And you're probably wondering, like, why are we talking about slavery, and what does that have to do with mental illness? But if you just think about slavery on a whole and how it relates to disorders just such as depression, anxiety, and PTSD. So then that kind of just tells you that, you know, mental illness has been around. It didn't just start today, and it certainly has always been a part and has affected the African American community. You know, in this article, it talks about how slaves were thought to be less sophisticated, and as generations to come, here we are today as African Americans, we're still struggling with those embedded misconceptions regarding mental illness and treatment services. So these are just some tips I put together that I, you know, again, doing research and working with clients and my colleagues and just working in the field in general, when we're providing treatment services to our clients, you know, in order for that individual to really make progress and start, you know, utilizing the services and continue with treatment, and again, especially with the African American community, there's just some things that, again, we have to work on when it comes to the barriers and the stigma. So, you know, I felt like we need to unite. It's not a one-man show. And so if we unite, then there's that support system. You know, bring awareness to the community. Let's identify the problems. You bring awareness by identifying the problem. If we don't identify that there's a problem, then no one's going to pay attention. So we definitely need to bring awareness to the community by first identifying the problem, then provide proper mental health treatment services. Let's educate everyone, including family, friends, and others in the community. If someone goes to their primary care physician and your primary care physician say, hey, you know, we ran tests and we detect you have diabetes, that individual is most likely not going to hesitate in starting treatment. You know, their physician recommend, hey, let's start taking medication, let's start cutting, you know, diet, or whatever is recommended by your physician, that person's going to follow through. And so I often wonder, why is it so different when it comes to mental illness, mental health? Because keyword health, you know, physical, mental health, it's whole health. You're treating the body. And so family members, friends, building that support system, bring awareness to the issue, and let's work together and providing proper treatment and educating everyone. If you have no knowledge, if you are not aware, then you're most likely not to do anything about it. You know, as far as educating everyone, let's include your family, your friends, and others in the community, law enforcement, school, churches. Let's, you know, include everyone. As we've seen, you know, this is a big one that we've also seen, you know, the past year, when it comes to law enforcement and how do you respond to someone in the community who's having a mental health crisis. You know, we've seen the videos on TV where law enforcement is called to the community, and, you know, it's not always the best treatment for that person who's experiencing a mental illness. And so we have to educate everyone, not just family, friends, but those involved in the community as well. You know, community partners, local leaders, religious sectors, school, and law enforcement. Let's be aware of your own biases, because we do have our own biases, or views and beliefs towards someone with mental illness. Oftentimes you hear someone say, oh, that person is, you know, the C word, crazy. Everyone who has a mental illness is not crazy. Mental illness on the spectrum of mental illness, you may have someone who experience or suffering from adjustment disorder, to someone who may be diagnosed with a more severe mental illness like schizophrenia or some other psychotic disorder. So everyone who has mental illness is not crazy. And so we, again, lack the education and the awareness. And so when you think mental illness, that stigma of, oh, you're crazy. If everyone that you came in contact with in your community, in your school setting, and at work, if they had a label on their forehead with all the different diagnoses there is, you will probably be amazed. This person that sits next to me in class, who is an A student, is diagnosed with bipolar disorder, or this person that I work with, that we're in the same office, is diagnosed with borderline personality disorder or PTSD. So you really don't know who has mental illness or not. And again, there's treatment out there, there's services, there's resources out there. It's just, again, just being able to reach out and receive those services, offer resources, referrals to those in need. And this, the last point I'll make, and I'll stop there. I think it's very important for us to know that it's not the individual's fault. It's not their fault. They're not a failure. You're not a failure. If you're experiencing mental illness, it's not your fault. You're not a failure. And you shouldn't feel like you have to deal with it alone. So let's reach out, let's utilize the resources, and let's try to help each other. And don't be afraid. Let's break the stigma in our community so we can do better and help each other. The end.
Thank you. Thank you so much. You provided us with a lot of great information. Some things I wrote down. I wrote down a lot, to tell you the truth, even though I do have this document, but I wrote down a lot. And I'm glad you touched on a lot of the key things that were going to be some of my questions about the Black community and how we, I'm gonna say we seek religion as our way of out of this. Oh, we'll just pray it out of them. They'll be all right. Just pray about it and it'll get better over time, where we're not really addressing the issue at hand. And same thing with the family, how you keep everything closed inside, or you swipe it under the rug and you don't really know what could have taken place if something was addressed earlier with an individual in your family. So I'm glad that you touched on that point, and building that support system within your family and really educating your family. I know it'll take a lot of time, but being able to educate individuals in your family or friends or in the community, like you said, I think that'll be very beneficial to be able to say, hey, I know a person. I know a person, I know a service that can assist you. And I'm just thankful for that opportunity for you to share that stuff and share all this information that you shared with us this evening. I do have a question. Well, not a question. I'm glad you brought this up too, about overdiagnosing and how it's really with the Black males. And that was going to be my question, which is like, why are so many Black males diagnosed with all these, I guess you can call them disorders, and that may not be the case. And then, like you said, it comes from not being able to get the right services or treatments or be diagnosed correctly. And so that's a big, I guess you can call it a hindrance that our community really sees a lot of. And so that's why we have that stigmatism of Black
Yeah,
men being angry.
yeah, we've, when it comes to the African American male, um, you're kind of viewed as, again, the stigma of you don't want to be seen as being weak. And that's just kind of a stigma that's been around for generations. And in my experience as a counselor, whenever I have an individual older or middle age, or young adult, each person is different, of course, individually. You may have someone who will share and give you everything. And when you're doing a formal assessment, you may have someone who's an open book that will tell you everything about themselves from childhood to adulthood. And you may get someone who's just more guarded. And so again, going back to cultural competency, if you're someone who's not familiar with, just the African American male, knowing that you're not always going to open up, you're not always going to share. That's just kind of how society kind of puts you in that box. And it doesn't mean that you don't have feelings or you don't have emotions, you know, or how to express emotions. But sometimes, even within my family, if someone passed, and we see this all the time, the women are usually the ones that are crying, wailing, and very rare you'll see the male person boohoo crying. Men cry, but yeah, so you often find that African American males are overdiagnosed or misdiagnosed because they're not properly assessed, or they may not be able to articulate how they're feeling or express how they're feeling and during that assessment. And so sometimes there's not enough information, sometimes there's misinformation. And so these can all contribute to that individual being misdiagnosed or overdiagnosed.
Thank you.
So I hope that kind of answered the question.
Yes, ma'am. Yes, it did. Do we have any questions for our guest? I don't see anything. Okay.
Yeah, again, this is just like a general overview. Mental illness is very broad. African American community and mental illness, again, it's a broad topic, and you can address and you can just kind of talk about different topics under just that one heading, from different age groups, demographic, location, geological location, background information, so it's very broad. But again, I hope the information that I presented today, you find it helpful. For those of you who are listening, you may not have questions now, or you may have questions, but you're just a little shy and not feeling comfortable to share. That's okay. If you even have a question in your thought, the fact that you've thought about something, or just whatever, I hope that whatever I've shared today just kind of, put something in your mind to think about. And so you may not share your question or you may not share your comment, but maybe when you go back to school or work or just at home, it's something that will trigger you to want to have that conversation with your peers or your loved ones, and just, let's sit down and let's talk about the issue. Let's talk about mental illness. Let's talk about the stigma surrounding mental illness in our community so we can address it and do better with addressing and treating it.
Okay, I do have a question. It's a two-part question.
Mhm.
It says, do you personally think that people can think that that their mental state is just who they are as a person and they have to handle it themselves? And then the second part to the question is, what advice would you give those people?
Okay, can you read the first part for me again? I want to make sure I got it.
So do you think that people can think that their mental state is just who they are as a
Mhm.
person?
Oh yeah, I do believe that people in general um, internalize issues that they've experienced, that they are experiencing, and um, and accept that as, you know, that's just me. And we hear that, and it doesn't mean, and again, when you think about mental illness, early I read a definition about, you know, it has to be causing impairment in your everyday life. So if you woke up this morning, you feel down because you lost your job, you don't have a mental illness. That's just, you know, you're going through we're human beings. We're going to express our feelings and emotions, and that's natural to feel sad, or you felt a little bit hopeless because, you know, you just lost your job. Pandemic came, a lot of people have lost their jobs, so it's an adjustment. However, if, you know, 2 weeks, 3 weeks have went by, and here we are, we're in bed, we're not getting out of bed, we can't think, we can't eat, we're just no interest. Then once it start causing impairment in your everyday life, that's when it becomes a problem. So yes, there are people who are individuals who may think that they're what's going on in their life is it's normal in their mind. They may think it's normal because they may not be they may not want to address it. They may be in denial about it, or they just may not be aware of it. I've met individuals or worked with individuals who will say, you know, I've been feeling this way since high school, and they will share stories leading up from childhood or young adulthood, teenage years to now they're 30, 40, 50 years old. And they just thought that was the norm. So yeah, I do believe individuals can feel like they're not experiencing a mental illness because they are either in denial or they're just not aware.
Okay, and then she
If
said, what advice would you give those people?
I would say if you're someone who, again, if the individual is not aware, and you know, it will be kind of hard for them to even seek help because this is like their everyday routine and they feel like things are just going great. However, if there's someone who you know or seen or just observe the behavior on a day-to-day basis, and you know there's just question,
You muted yourself.
um,
There you go.
you know, for their age, for, you know, their, you know, as it relates to their age and the onset, the duration of, you know, what's going on. If you're in that position where you can reach out to that person and say, hey, I notice, you know, you know, sit down and have a conversation with that person, just share with them as a friend or family member saying, you know, I'm concerned. This is what I've been noticing, and just kind of have that dialogue. Because again, maybe they're not aware of it. I mean, certainly if you went from a happy person who loves life, who's involved in social activities, who, you know, is productive and goes to work and school, to one day you're home in bed, no interest at all. You don't want to get out of bed. You don't want to eat. You don't want to participate in any social events. You're afraid to come out the house. And certainly something is wrong. So, you know, again, if you are able to reach out to that person, have that conversation. Just share with them what you've observed. I find that the person is they may be more open if you share in a more concerning way versus you're telling them that something's wrong with them.
Yes. I do have a question, and it just yes. So let's say we do have that individual that's not seeking treatment or even thinking about that. They're using their own personal way of treating it. So abusing some kind of substance. I know you have, but what would your advice be for an individual that says, oh, I'm depressed, so when I get depressed, well, all I do is smoke weed?
Yes.
And they think they're fine, but I guess bring that back to reality, bring it to reality that that's not a good treatment, a self-treatment option for them.
Yeah. And that's exactly what it is. It's like self-medicating, what we would say. And people do it all the time. People self-medicate. They're, using marijuana or some other drug or alcohol to self-medicate, to cope. Because I hear this so often. I don't want to take pills, but because I don't believe in it, or I don't believe in the pill. But yet they're putting other chemicals in their body that is causing harm to their bodies, like using alcohol and smoking marijuana. And so, if there's someone that is out there that is certainly experiencing some type of mental illness or crisis, or just in a situation where you're going through and you are currently drinking alcohol as a substitute, or using or smoking marijuana or other drugs, whether street drugs or prescribed medication, that's a whole nother topic. Again, seeking help so that you're not self-medicated, because what ends up happening is now you create another problem. You're trying to self-medicate to treat the current problem. Now you're drinking, and we know that can lead to becoming, you can start abusing alcohol or, the marijuana use. So you now create other problems. So if that individual is open to getting help, that, and first, again, realizing that this is, you're self-medicating. The person may not acknowledge it, or they may not think that they are, but again, that's where the willingness comes in for the individual to seek help. Because again, you can't force someone to receive help. They may not be ready, and if they're not ready, they're just not going to be receptive to the services. But self-medicating with substance is not the best route to go, because that's just going to create other problems.
Thank you. I know you mentioned it at the beginning, but if you could go over what types of services Apalachee Center offers.
Okay. Yeah, so Apalachee Behavioral Center offers quite a bit of different services. On an inpatient service, because most people, when you think of Apalachee, they think of the hospital. So on an inpatient level, there's the psychiatric hospital, where if someone is Baker Act, which is where you are involuntarily brought in by law enforcement, or the judge, or a licensed qualified practitioner can serve a Baker Act. And so if someone is a threat to themselves or others, so if you're having, for example, suicide ideations, thoughts, or a plan or attempt, if you're a threat to yourself or others, and law enforcement is called, you can be Baker Act, where you will be brought in for like a 72-hour monitoring in the psychiatric hospital. So usually the hospital is when you're at that severe crisis level where you're a threat to yourself or someone else. And that's where you would be brought into the hospital, either voluntary or involuntary. Involuntary, again, you're brought in by law enforcement, or voluntary is, yeah, you feel like I'm having suicidal thoughts, I may attempt, and I need help, and you call a crisis hotline, and they, and you say, I want to go, I want to get help. So that's the hospital inpatient services. There's also children's and adult. Apalachee has the children's unit. It's called Beach, and that's for minors 18 and under. And I think they opened up maybe 2 years ago or 3 years ago with the children's unit at the hospital. And same standard. You're either Baker Act or you are brought in voluntary. So that covers inpatient. Then there's the mobile response team, which is kind of like Appalachee's crisis hotline. So, there's a national crisis hotline, there's a suicide hotline, there's VA crisis hotline, there's Big Bend 211. So there's all these hotlines. So there's resources there, I would say, especially in the Leon County, Big Bend area. But Apalachee also have their own mobile response team, and they basically 24 hours, you call, you're having a crisis, they will come to you. They will call law enforcement, whether you're in Leon County or the other counties that we serve, Franklin, Jefferson, Taylor, Madison, Liberty. If you call from those rural counties, they try to connect with law enforcement there if someone is a threat to themselves or others. There's the FACT team, which where used to be Bethel Center of Tennessee, is now Apalachee, right by the bus station or Popeye's Chicken. So it's called Bethel at Apalachee. They have a homeless project there, and it's more community-based service that's offered there. So if you are someone who live in a transitional housing program or somewhere, or the shelter, and you need services, you don't have insurance, you can certainly get assistance through the FACT team and their homeless program. There's also CAT, which is Community Action Team. That's another service. And then there's the outpatient service, where all the different counties, the outpatient is where you're less severe. Outpatient is more like you're maintaining. You come in, you meet with your psychiatrist, you meet with your therapist. I kind of fall under my position as an intake counselor. As I said earlier, I do the assessment and refer to the different outpatient programs in the different counties. So I kind of fall under that outpatient. Sometimes I may refer clients coming from the hospital or someone who's just looking for services. I think I've covered, yeah. So outpatient services, inpatient, hospital, children's unit, mobile response team, outpatient, the FACT team, homeless project at Bethel, the CAT team. So I would say there's a program for everyone. We serve insured, commercial, and uninsured clients as well. So if you don't have insurance, that's okay. Still call the agency. We provide case management services, therapy services, psychological services. Now there's a pharmacy in the Leon outpatient office, and a primary care. We used to partner with one of the other local health community partnership for providing physical health services. Because again, if you don't have insurance, you may not have the means to see a primary doctor, and you want to address the whole health, not just the mental health, but the physical health. So we also provide primary care service at the outpatient clinic, and we have our own in-house pharmacy. So yeah, lots of service for everyone.
Yes, thank you. How would someone get in contact with Apalachee?
Okay, well, you can, of course, call the main number, which is, that's the only number I've memorized, 523-3333. That's the main number. When you call that number, you'll listen to the prompt for all the different departments and services, or you could press 0 for the operator. So that's the main number. You can also just Google Apalachee Behavioral Center, and it will either route you to the website with all the contact information for all the different programs as well.
Okay, awesome. Thank you for that. I guess all the questions have been asked. I want to thank you again for sharing this information about the services that you all provide and what mental health is and how it has and still is affecting the Black community. And if you're viewing this, it can just take out the African-American Black part and just look at it as mental health as a whole, or mental illness as a whole, and how it's affecting outside of the Black culture or Black community, because it's affecting a lot of people, every race, every culture, every age, especially during this pandemic. It's affecting a lot of youth. So just be mindful of what Mrs. Page presented this evening, and get to know more about, do your research on Apalachee Behavioral Center and what they have to offer. And if there's a presentation that needs to be done, I don't think they'll turn it down, and get out in the community as well as what they're doing already with different resources set up within the community to help assist people, citizens of the community. So I thank you again for your time and this valuable information that you shared this evening. And I want to thank those that tuned in and logged in on this Zoom Wellness Wednesday mental health. We'll continue mental health Wellness Wednesday the week after next. So there's no Wellness Wednesday on the 17th. It'll continue on the 24th, and we'll have Department of Health do their presentation, and we'll have updates about COVID-19 as well. But I want to thank you again, Mrs. Page, for your time and the wealth of information that you provided, and thank those that logged on. Thank you for logging in, and feel free to reach out to me. I have Mrs. Page's contact information if you want to reach out to her, or Apalachee Behavioral Center. So thank you again, and you all have a great, wonderful evening, and continue to stay safe and be well.
All right. Thank you. Thank you so much for having me, and thank you for all the viewers and listeners. And again, I hope you take away something that's valuable tonight. And like Charlie said, if you take away the race part of it, mental health affects everyone. It doesn't discriminate. However, primarily when you think about African American community, there's still that disproportion when it comes to, receiving services and addressing mental health. But yes, it takes everyone to be a part of it to break those barriers, and so that we can be more aware, be more informed, and receive the services. So thank you for having me. It was a pleasure, and I hope what I've said or shared will, someone can take away from this. And just thank you and be safe.
Yes.
All
All right,
right.
y'all have a good night.